Good morning, everyone. Today we are here with Dr. Prakash, sir, the HOD of MPH at JD Goenka University, and we are discussing about the topic of tuberculosis in India. Good morning, sir.
Very good morning.
Sir, just let us know like what was the tuberculosis that ruling now in current scenario, like today nowadays.
Yeah, tuberculosis is a global problem. Among the infectious disease, it is one of the biggest global problem. And India having one of the very large proportion of population across the globe, so we also have a very large burden of tuberculosis. When India was not independent, there were a lot of challenges like challenges of nutrition, challenges of health system not being affected. So we are having one of the biggest burden. But post independence, now we are making good development. One place we are improving on nutrition. On the other side, we are having lot of government programs which is looking to spread awareness, and we have increased screening coverage also. Like in government hospitals now, all the diagnosis of tuberculosis is completely free. So we have a good infrastructure that is coming, but yes, challenges are still big because as we discussed, our population is big. So definitely we have to fight a long battle before we can make it absolutely vanish from the geography of India.
Sir, what was the reason, like why only the lower class people or low socio-economic strata were more being involved or being more diagnosed with TB rather than the people who live in the very good locality?
Wonderful question. I mean, tuberculosis is a disease caused by bacteria, Mycobacterium tuberculi, and it has got a pan world footprint. That means it is available all across the globe, and it has been seen. I mean, there is a very interesting public health history. In Europe, tuberculosis incidences started declining as and when the Europe started having good nutrition and better living condition. As you know, post economic development of industrialization in Europe, that was around 1600s. So they made good development, but after colonization started coming, so especially we have got a case history of Britain. So Britain's economic conditions started improving in a very quick fashion because it was having all the advantages of colonization. So all of a sudden in public health history, we see that after 1850s, 1860s, the tuberculosis incidences started coming down in Britain because people were having more and better nutrition, and the second thing was that living condition of European people and especially the British people also started improving. So one thing is that even before the treatment started being available, the incidences of tuberculosis went down in richer population. So it can be attributed to two facts. Fact number one is that if the living habitat is such way that there is no overcrowding, so even if one person is infected with tuberculosis, it won't spread from one person to another person. But imagine in a condition where in a small shanty like a hut, 10 people are staying. So even if one person is infected, chances are that all the 10 people will be infected. That's point number one.
Yes, sir.
And point number two is that most of the time, if we talk about nutrition in pure public health sense, carbohydrates are cheaper as compared to protein. So poorer people will be having less access to nutritious protein sources. So then definitely their immune system is also weaker. So they become more vulnerable.
Okay, then you say that the overcrowding is also one cause of this
A big
tuberculosis.
cause, a big
Okay,
cause.
okay, sir. Sir, then coming to what were the signs and how to predict it in early stage?
Wonderful. Actually, I would through this channel, I would like all the viewers to understand some very basic symptoms which can be identified by almost all the people, even lay people. One is low grade fever. So patient will complain, and many times people do not even notice because you are not really taking temperature every day, and it goes on for say weeks and months. But if you notice, then you find that generally there is a low grade fever around 99 or 100 degree Fahrenheit. Then there is profuse sweating at nights and many times other time during the day also. Patients start feeling tired very frequently, and throughout the day also the patient is tired. Then we see there is a coughing, persistent coughing, and along with these symptoms there is tiredness, there is low grade fever continuously going, then there is persistent coughing. With these three symptoms, we request the patients to go to local hospital, government hospitals also, and right from screening, and if patient is found to be positive, treatment also, everything Government of India is now providing all free.
Okay. Sir, as you said, the treatment, as the topic came, I have heard that tuberculosis treatment is lasts so long. So how would I use it? Like, why should I use it? People are having these kind of
True, true,
misconceptions.
true.
So how we will send? What was the treatment for it? What the
A very important question, and especially for Indian population, we generally have not such a great regard and discipline for taking medications in a regular fashion. Antibiotic abuse and many times medicine abuses also are very common in our community. So we need to understand this, that tuberculosis many times averse to taking long-term medication. But as we discussed, tuberculosis is one organism that survives in human body for really long. So if we want a lasting treatment where you have removed tuberculosis from all across the body, you should take the complete treatment. And yes, which can be many times for long, like 6 months, sometimes in some rarer cases even around a year. But I would request through this channel to all the viewers that medicine need to be taken for complete dose if we want to cure tuberculosis. And there is a word of caution also. If you discontinue the medication, then the next time what we medically call a second line treatment will be used, which many times can prove to be harmful as well. So I would request all the patients, if you have been diagnosed with tuberculosis, take the complete treatment for all the duration, stay in touch with your doctor, and when your doctor tells that there is no longer need for taking medication, you should stop it.
Okay. Sir, lastly, we are almost being successful in this tuberculosis eradication problem, not eradication but elimination program. Like almost the cases are being dropped nowadays. So, as a public health worker or a public health scientist, what would you prescribe or what would you suggest for the general public to reach its approach to eradicate or the elimination program of tuberculosis?
One thing that I talk to all the students is, students being the young ambassador of the nation of India, you should take an initiative and spread the knowledge about all the diseases, and particularly tuberculosis, malaria and HIV, the big three which are latent threat to the global economy and the global population. For that, we need to talk more to the lay population about the symptoms so that everyone is aware. If they find coughing or low grade fever or tiredness or night sweats, they should complain to physicians. And then when there is awareness and everyone is screened and everyone is, if at all they are having infection, they are diagnosed early, we can provide right treatment, and government has got good facility of treatment. So that way we can completely remove the burden of tuberculosis from Indian population and gradually across the globe.
Sir, lastly, let's quickly just end this session here. My question is like, is this tuberculosis is completely curable or just we have to do prevention for it? Like,
No, the best part about all the infectious diseases, they are completely curable. After a certain long length treatment, we can say that the tuberculosis has been completely been cured. But the only word of caution is you should stop medication only under the guidance of a doctor, and when your doctor tells you, then only you need to stop it.
okay. So thank you so much, sir. Like we have
Thank you.
very good knowledge of tuberculosis and complete knowledge. You have covered every topic in this video, where the viewers also will be feeling little educated. and they will also get the more exposure of what is tuberculosis, and they can also explain to someone else. So thank you for giving your valuable time for us, and we are so happy to have you here, sir. Thank you.
Thank you.
Thank
Thank
you.
you.